Chicago Mayor Lori Lightfoot laid out a five-star plan for reopening Chicago Friday, a multiphase approach that offers no timetable but sets tougher benchmarks to meet before easing stay-at-home rules than Illinois Gov. J.B. Pritzker said in his statewide strategy.
Lightfoot's plan layers additional standards for rates of infection and testing capacity on top of the state rules the governor unveiled earlier this week. As with Pritzker's Restore Illinois plan, Lightfoot's framework sets a high bar for returning to normalcy.
Lightfoot can't set looser standards than the statewide ones laid out by the governor, but she can tailor them to the city. Her plan is specifically designed for Chicago's residents and businesses, and encompassing a clear, data-driven five-phase process, she said.
Obviously, the governor's plan is one that covers the entirety of the state, but there's a lot of differences between, Chicago and Cairo, from us to Peoria, and Champaign-Urbana, she said. So I think the beauty of the governor's plan is it allows us to use local specific data to dig down into particulars on how we're going to protect the city of Chicago, based upon the data that's different here than it is in other parts of the state.
The Chicago blueprint also lets the mayor set her own course politically rather than turning over the keys to the virus response to Pritzker, and perhaps gives her leeway to work with restaurants and other businesses to plot a separate route to emerge from the economic disaster that's hitting the city and state. It's not yet time for that, though, Lightfoot said Friday.
We've begun to flatten the curve of Chicago's COVID-19 cases, she said. However, as I said before, we must never confuse promising gains with outright success. We are not at the point where we can begin reopening our city yet. The light at the end of the tunnel is absolutely there, but it's still just a glimmer, and we still have a long way to go before we can safely return to the way things were before.
Chicago is currently in what the city calls Phase 2 of its recovery, a period Lightfoot's plan dubs stay at home.
Before moving into Phase 3, labeled cautiously reopen, the city would need to see a decline in the COVID-19 case rate over 14 days and a declining rate of new cases, stable or declining rates of hospitalizations, ICU admissions and deaths, fewer than 1,800 coronavirus patients in hospital beds, fewer than 600 coronavirus patients in ICU beds, and fewer than 450 coronavirus patients on ventilators, Lightfoot said.
The city also would need to be able to test 135,000 residents per month, with positive rates decreasing below 15% of those tested in the community and at least 14 days of declining rates of new cases, on average. Positive rates of below 30% would be needed in congregate settings such as nursing homes, shelters and jails, according to the Lightfoot plan.
Those standards are stricter than what Pritzker laid out earlier this week for his statewide plan. The governor called for positive rates at or below 20% and an increase in the positive rate of no more than 10 percentage points over 14 days.
That could further aggravate rest of Chicagoans, local business owners and elected officials as warm weather arrives and residents in other parts of the state potentially start to meet easier requirements and enjoy more freedom to move about and gather in public places.
On Friday, Pritzker said Lightfoot's plan is a good one for Chicago, though he said he hadn't seen the final version in detail.
While his plan requires hospital admissions for COVID-19-like symptoms to be stable for 28 days, among other criteria, before a region can advance to the next phase, he doesn't see that conflicting with the 14-day timetables in the mayor's plan.
It is likely that because they have some more stringent parts of their plan that when you put all of the pieces together, from a timing perspective, it will fit, I think, nicely into the framework that we put forward, Pritzker said. And I think other local governments should be considering doing the same thing.
The governor said he considered requiring a decrease in cases before a region could reopen but opted for requiring stable positivity rates and hospital admissions.
For those who think that we ought to be opening more quickly, I would say that our plan makes it more likely that one could open at the end of May than some other plans, he said.
While she wants a framework appropriate to the denser urban setting in Chicago compared with the rest of the state, Lightfoot risks a backlash if the city struggles to clear her higher hurdles.
For example, in order to meet the approximately 135,000 per month test standard, the city would need to test about 4,500 people per day. According to city records, an average of 2,966 people were tested for the virus each day in Chicago over the week ending Thursday. More tests could also mean higher rates of positive results.
Under Phase 3, select businesses, nonprofits and city entities would open, with demonstrated, appropriate protections for workers and customers, though non-business social gatherings would be limited to fewer than 10 people.
Face coverings would still be required, Lightfoot said.
The mayor's plan doesn't estimate the earliest Chicago could change phases. Under Pritzker's plan, the earliest a region can move from the second phase to a third, recovery phase is May 29.
Lightfoot said she wouldn't give dates for when reopening might be possible because the decision needs to be made by data and any date would be completely arbitrary.
The mayor also refused to set a timetable for restoring access to the lakefront, a significant piece of Chicago's civic psyche that she closed in late March along with the 606 elevated trail and the downtown Riverwalk after residents packed into them on a warm afternoon.
A lot of that is going to be guided by the science, and I have to be confident that we can open up those larger venues, the lakefront, the 606, interior trails in a way that still allows us to maintain social distancing, Lightfoot said.
But she said she's open to outside-the-box ideas like assigning different times of the day for joggers, walkers and bikers to use the trails or hiring social distancing ushers to patrol and order crowds to break it up.
Lightfoot said she would release standards for moving to Phase 4, labeled, Gradually Resume, and Phase 5, Protect, over the coming weeks. Details such as the sequencing of reopening businesses and public services are still being determined and will take factors such as transportation and child care into consideration.
Before transitioning between phases, Lightfoot said the city will evaluate whether the disease's spread is slowing across the city and surrounding counties. Transitions between phases also will depend on whether the city has testing and contact tracing capacity to track the disease and limit spread and whether the health care system can handle a potential future surge.
The city also will evaluate whether there are enough support systems in place for vulnerable residents, Lightfoot said.
One item to watch is how the city and state address restaurant reopenings in coming weeks. Pritzker's rules for reopening have been criticized by Illinois Restaurant Association head Sam Toia as too strict, while Lightfoot has included Toia on a coronavirus recovery task force.
On Friday, Toia appeared with Lightfoot at her news conference and praised her for taking a thoughtful approach to reopening our economy.
The mayor left the door open for restaurants to reopen sooner than late June but said such decisions would need to be based on strong science. She did say no restaurateur wants to be at risk or endanger customers, but there are potentially innovative ways they could reopen.
In recent days, Lightfoot has cautioned against ending the state's stay-at-home order prematurely or loosening restrictions. She has said doing so might lead to a spike in cases, pointing to examples in Japan, Singapore and Germany.
Repeatedly in the past 2 months, Lightfoot has likened the fight against the virus to the comeback from the Great Chicago Fire.
On Friday, she described her reopening plan as a 5-star endeavor, and floated the idea of symbolically elevating the pandemic response to a status alongside the fire that would also provide tattoo parlors across the city with an economic boost in their recovery. I want nothing less than for our efforts over the coming months to truly warrant a 5th star on our flag.
Chicago Tribune's Joe Marr and Hal Dardick contributed.
G. Pratt at ChicagoTribune.com.
Jebern at ChicagoTribune.com.
D. Petrella at ChicagoTribune.com.